Betadine Sore Throat Gargle contains povidone-iodine 0.5%. It is an antiseptic, which helps kill bacteria and reduce infections in the mouth and throat. It is commonly used for sore throat, mouth ulcers, gum swelling, and conditions like gingivitis. It's very important to use this product correctly. Pour 10 to 15 milliliters of solution into the cup. Dilute with an equal amount of water if taste is an issue. Then tilt your head back and gargle for 30 seconds, swirling the liquid on your throat. Spit out the solution, and don't swallow. Repeat up to 4 times daily or as directed by your doctor or pharmacist. Children under 12 should not use this product. Betadine Mouth Gargle should not be used for more than 7 days unless directed by a doctor or dentist. If symptoms do not improve within a week, or if irritation, pain, redness, swelling, rash, or fever develops, stop using it and consult your doctor. Do not use if you are allergic to povidone-iodine, have thyroid problems, or if instructed otherwise by your healthcare provider. Be careful, as it may stain clothing or dental work, and avoid contact with jewelry, especially silver. That's all about Betadine Mouth Gargle. If you found this video helpful, please like, share, and subscribe to our channel.